Hello, my name is Dr. Stefan Toka from the dental clinic Dr. Toka in Sopron in Hungary. Dear patient, I have received your CT scan, which was made in the UK. I downloaded it and I created a three-dimensional plan just to explain to you what I can see in that X-ray, what teeth need to be removed, and what kind of treatment options there are. This video is anonymous, so nobody can see your name. This here, the first picture, is a three-dimensional reconstruction of your upper jaw and your lower jaw. In the upper jaw you have a large bridge. I didn't segment in the bridge parts, so you can only see your actual teeth that are in there. You can see them in different colors. Red is a color for not so good situation. These teeth might have to be pulled, and the golden ones are still teeth in a good condition, as far as I can see in the CT scan. Let us concentrate on the lower jaw first. There are two implants floating here in the air, and never mind those. What you can see now is your lower jaw, and you can see that you have two gaps, on the right side one and on the left side one as well. And if I make the bone see-through now, so we can actually see the shape of your teeth here adjacent to the gap, and also you can see one tooth is marked in red. It is on your right side, the very far in the back, the wisdom tooth, which seems to be in a bad condition, and it doesn't really have a function there. I would recommend the removal of that wisdom tooth. In order to close the gaps, we can place two implants, one on the right and one on the left, and these implants can hold single crowns right here in the gap. That is one option. So you can place one implant and place a crown on top, and the gap is closed already. The other option would be to place a so-called bridge. You have bridges in the upper jaw, or you have a large bridge in the upper jaw. We can make a bridge from the teeth here in the front towards the back. But for that, your teeth have to be in a good condition. Unfortunately, in the CT, I can see the bone very clearly. I can see if there are any inflammations, but I can't really see if you have any big cavities on your teeth. That's why I can't really say right now if a bridge would be a good option as well, but I can say that the implantation is possible, which is very, very important. One thing you have to consider when we place an implant in the lower jaw is that you have an important nerve going through the bone, going through the lower jaw, right here as you follow my mouse. You can see that the implant is placed right above this nerve. So when we make this CT scan, and we have to make this CT scan in order to measure how much bone there is from the surface, which is inside your mouth, all the way to the nerve canal. There is a minimum, and we also have to look at the height and the width. The bone has to have a certain thickness as well in order for us to be able to place an implant. If we look at this implant here right now, let me just change some settings. You can see here that we place 10 millimeter implants, and that's a very, very good number. 6 would be the minimum, and we are at 10 millimeters. And if we make a little cut through the bone here, we make a slice through the implant, we see this picture here. We can scroll through the implant. This is the actual size of the implant. Here you can see the nerve, and this is a cut through the bone. Here is your tongue, here is your cheek, and here is the upper jaw. So this is the lower jaw with the nerve and the implant, and we can see that the bottom of the implant is still kind of far away from the nerve, so there would be a very, very small risk of nerve irritation or nerve damage in this situation. In very, very rare cases, even if you don't touch the nerve, this nerve can be irritated, which would lead to a numb sensation on your lip on the same side where the nerve was damaged. But we can talk about that personally when you come and visit us. You have very good bone. You have a lot of bone on the other side as well. Same situation as on your right. On the left side as well, we have more than enough bone to place an implant with the length of 10 millimeters. Regarding the price, my assistant will send you also a cost estimate about the placement of the implants in the lower jaw, which is a separate cost estimate, and you will get one for the upper jaw. Let's go to the upper jaw now. Let me just click some buttons here. I'm going to make the lower jaw disappear so it doesn't distract us that much. Okay, when we look at the bone from the outside at first, some important anatomical features are: this is your upper jaw, and these parts here, this is the beginning of your nose. Yeah, this is where your nose begins. If we look at the bone from the top, you can hear the nasal cavity. This is where the air goes in and out when you breathe through the nose. And on both sides of the nasal cavity, here in this area and in this area, you can see your sinus. Yeah, you can see really far into the sinus. The sinus is a large cavity inside the skull filled with air, and when we want to place implants in the back part of the upper jaw, we have to consider the sinus. Obviously, how big is the sinus? Do we reach the sinus if we place an implant with, for example, 10 millimeter length? Now, the teeth you have on the right side and in the front, there are not many. You have the two canines and also tooth number 2 on the left side, which seem to be in a good condition. When we make a slice through the teeth again, let me just go the right direction. There we go. When I look at these slices, I go through the teeth. I can see that they're in a very good condition. So the bridge here in the front and on the right side seem to be in a good condition, but the last tooth on the right side does need to have root canal treatment. Yeah, it's this one here. When I go through the bone here, yeah, you can see one root and the second root of this tooth. It has 3 roots in total. Okay, there's the other one, yeah, hiding behind it. And what I can see is this little thing here. Yeah, that's a little inflammation, and also right here. This is not supposed to look like this. This means that this tooth has basically died off, and there are bacteria inside the root canal. Yeah, what is the root canal? The root canal is the cavity inside your tooth. Yeah, you have blood vessels and nerve vessels going through the inside of the tooth, and sometimes this tissue inside the bone gets attacked by bacteria. It gets infected, and that leads to the death of the nerves. And also, the first sign or a chronicle sign of that is that we can see here these dark little spots at the tip of the root canal. So this tooth needs to be root canal treated so that this inflammation inside your bone doesn't get too big. That's very, very important. If the bridge is good inside your mouth, which I cannot tell from this CT, but I'm guessing it's still alright on the right side and the front, it can stay. But on your left side, it looks a little bit different. You have, if we look at this 3D picture, you have 3 teeth here on this side. Let me just make the implants remove. Yeah, you have 2 teeth in the back and then 1 in the middle, and this is your canine, yeah, in the front. These 3 teeth are not in a good condition. If we look at this small one here in the middle, yeah, and you can see that the bone is very irregular. It kind of looks different compared to the other side, yeah, or maybe to the front here. It's supposed to look very smooth, but you can see something is not right here. And if we make a cut through this tooth again, yeah, we get this picture here again. Yeah, you can see here the slices. This here is the root of your tooth, and you can see this dark spot here again. This is not supposed to look like that. This white stripe should go all the way down here, which means that this tooth here has a root canal has a root infection as well. But it's a very small tooth, and it doesn't seem to be in a good condition. And also, we're losing bone here. The same with the teeth here in the back of the left jaw. You can see a big cavity here. Yeah, I can see through the bone, through the teeth, and that's a sign for me, which I have to check in your mouth again, that these teeth are not good anymore. They have to be removed. Now, what do we do now if we remove these teeth here and leave the bridge on the outer side and the front? We can again place 2 implants. We're going to make the bone see-through, place our 2 implants, and these 2 implants, this one is placed in position number 4, and this is in position number 6. So we can make a bridge on top. Yeah, 2 implants can hold up to 3, well, more than 3 crowns, but in your case we need 3 crowns. So we're going to replace 3 teeth, 4, 5, and 6. Not more, we don't have to go all the way to the back where we had the other teeth here. Yeah, those are not necessary medically. You only need to have teeth all the way to tooth number 6. So if we place these 2 implants and make a bridge with 3 crowns on top of them, you will be absolutely fine. But we have to consider one thing. I mentioned the sinus before, and if we look into your sinus right now, I can see that the bottom part of the implant looks through the sinus. This is not supposed to be like that. The sinus is filled with air, so obviously this implant will not have enough retention here. We will lose it if we don't cover this place with bone. So what do we have to do? We have to do a little bone augmentation. How does that work? We take some artificial bone, make a little hole through from your mouth into the sinus, a very surgical, it's like a microsurgical procedure. Then we place artificial bone at the site where we want to place the implant. Yeah, we're basically going to cover it. That's how it looks if we animate it. Yeah, and this artificial bone will be converted into your own bone by your cells, and in approximately 6 months, these implants and the bone have completely healed in, and we can place the crowns on top of them. So it's quite a long healing time, I know. 6 months is a long time, but unfortunately the bone, especially in the upper jaw, needs some time for it to get really strong and be able to withstand the biting force here in the back. So we have to wait those 6 months. So for you, so that you don't have to go without teeth in the upper jaw here, there's unfortunately only one option. We have to make a removable temporary denture, yeah, which you can put in and you can chew and you can smile, so nobody will see that these teeth are missing. But it's obviously something you have to get used to for 6 months, and after those 6 months we can make a fixed bridge. In the lower jaw, you don't need to have a temporary or a provisional denture or anything else, because you already have those 2 gaps there. I don't think it's going to be a problem for you to have these gaps for another couple of months. The entire treatment procedure would be that you come to us the first time for the operation. The first sitting, we're going to place the implants, extract the teeth which need to be extracted, and obviously if we have to make some changes in the plan, we're going to discuss it here with you. 1 week after the first surgical procedure, after we place the 4 implants, you need to get your stitches removed. There are 2 options. Either you can stay here for a week after the implants. We have a very nice opportunities here. You can visit Vienna, you can visit Budapest, you can even stay in the area for a little vacation. And after 1 week, we can remove the stitches and also make a little checkup on if everything has healed in correctly. But you can also go to your physician at home and get your stitches removed in the UK. That is also an option, and Catalan Prices, I'm pretty sure, happy to help you with that. After then the healing time starts, 6 months. After 6 months, you come back to us. We take some prints of the place of the implant, and 1 week later, the crowns are ready. That means you have to come at least 3 times. First time implantation, 6 months later prints, and 1 week later the crowns are ready. Okay? So the entire treatment is a long treatment, but between those treatments we just have to wait for the bone to heal in. So much to the treatment plan. The cost estimate will follow in the next couple of days, and if you have any questions, you can talk to Catalan Price. You can write us an email, and I will get back to you as soon as possible. Thank you very much, and goodbye.